joined, so we recall. Thank you, sir. Thank you, all the experts who associated and participants. For the last 1 year, you have been traveling with us. Thank you very much for your active participation and make the platform ready. Now it is time to welcome our chairman, DMRT, Mr. Michael Vedasiromani, sir, former additional chief secretary, Government of Kerala, who is the current chairman of our DMRT forum. So we thank, and last 8th, sir, celebrated his birthday. Just a few seconds. These words, we welcome our chairman and our session moderator, Professor R.R. Krishnamurthy, sir. Professor and Head Department of Applied Geology is the main source of inspiration for the last 2 webinar series. Sir, thank you very much and most welcome to this panel. So we have served around 30 sessions. We have covered, of which the main subject focused was hazard risk vulnerability profile, Sendai framework, sustainable development goal, and Prime Minister's 10-point agenda. We discussed around 25,000 plus active participants participated with us. So we thank all the participants who associated and get connected with this program. This webinar series, as our Professor Krishnamurthy sir said, Applied Geology Department of University of Madras, Nazreth College of Arts and Ayyappa College for Women, and DMRT jointly organizing this webinar series. Next, we welcome our Professor Suresh Mariaselvam sir, another source of inspiration, who always encourage all the activities of DM, especially in the area of identifying right. Also celebrated his birthday on 9th call. So thank you. With all this happiness, we welcome all the distinguished experts, distinguished delegates who associated with this program. Thank you very much. Welcome everybody. Thank you.
Okay, thank you very much. Now that the mic is handed over to the speakers, so requesting them to engage the participants.
Thank you. Thank you very much. Namaskar. Thank you very much, Chris. It is very nice to see also Professor Vinod Menon ji, also Suresh, and all our colleagues. And of course, it's a privilege to share the, I won't say stage, but at least the webinar platform with Anshu, a very good friend for so many years, and with whom I learned a lot actually. And thank you, Chris, also to remind me about our initial work, our first book. And I'm so happy that the system which we developed that time is also still continuing, and at least recognizing some of the good work in Department of Applied Geology in University of Madras. And I think, sorry, sorry, my video was off. So yeah, so I think thank you for reminding me all these nice memories of almost maybe 15 plus years back. And also I'm very happy to know that that time the Chennai's mayor is now the health minister. I very fondly remember working with him, also inviting him to Incheon in one of our this Asian Ministerial Conference in Korea. And he was so proactive actually to lead the climate disaster resilience studies in Chennai. So thank you very much. Anshu, how would you like to proceed? May I first see, so a couple of slides, not couple of slides, maybe around 10 slides or so. And then should we start, or would you like to have a dialogue first, and maybe we will? So
I think to make good use of time, let us do that, Rajib Sensei, that you share a few slides more as pointers, and then so for everyone's information, what Rajib Sensei and I decided was to have more of an open interactive session and a conversation between us also and with all of you, instead of both of us showing a lot of slides. In any case, after Professor Rajib Shaw has shown slides, who can dare to show any more slides? You can never meet that bar. So I think we should do that, Rajib Sensei. You go ahead, and then let us try to make this a useful interactive session. Over from me.
You know, Anshu is always a very eloquent presenter and orator, and he really doesn't need slide. And for me to means put my words into my thinking into words is very important. So please allow me to show certain slides, and what we say that to do a little bit of PowerPoint torture with all of you. And I'm sure that as a student, you are possibly accustomed with the PowerPoint torture. What I would like to share today, a little bit of experience, what we have been doing, what we have been experiencing, especially in Japan and on these COVID-19 responses. And then at a later stage in the discussion, we will come to more like what can be the lessons, or what can be linked to the overall topic of people and technology and community, which is the broader topic of this webinar. You know, let me first start with this word, which I strongly believe and which we have seen possibly last in 1.5 years, is that the pandemic is global, but its responses are local. And there is no single one fit for all solution for this global pandemic. It very much depends on the local, I will say, the governance system, the legal system, the local cultural context, people's behavior, availability, accessibility of technology. So it's a combination of many, many different things. The leadership at political level, leadership at the community level. So it's a very complex dynamics, and we have experienced, even in one country, like we say in India is always full of diversity. We understood that, but this pandemic had showed us very clearly that north, south, east, west, we see totally different types of governance mechanism, totally different types of people's behavior. And it's so much rooted into the cultural context as well. So with that in mind, let's just first see what is happening in Japan. Just 3 days back, we had the Olympic just completed, and there have been lots of positive side, some challenges regarding this Olympic, especially in this type of pandemic time. But before I go into the current situation in Japan, let me just put a few context that for Japan, there are 4 or 5 specific contexts, which makes it very, very unique. Number one is that it was close proximity to China. From Wuhan to Tokyo, there are around 7 direct flights last year before this pandemic started. So there is a huge travel, like huge people who were traveling between these two cities. So you can imagine that the spreading risk is very high. Then many of you possibly know that Japan is famous/infamous for its aged population. So 29%, almost 1/3, less than 1/3 of the overall Japan's population is more than 65-year-old. So that makes also it's a very, very highly vulnerable. High urban density, what you are seeing here in the photos, the Tokyo's metros, the subways are again infamous for its extremely crowded during the peak hours. So the very high urban density as well as crowded public transport. So these all issues, so close proximity to China, aged population, urban density, and public transport make the whole country as a whole extremely vulnerable and prone to very high rate of spread of the disease. And there were a little bit of legal issues that Japan by law cannot have a forced lockdown. Japan's constitution does not allow to close the shops by law or ask the people to stay in home as a legal instrument. So Japan cannot do that. What Japan can do is only request its citizen to stay in home or request the shops to close or request the business industries to promote the COVID-19 protocols and so on. So it is all on request basis. And so there is no forced lockdown. So you can imagine that there are some sort of legal struggle of that. And then the vaccine complexity. Japan has a very sort of bitter past experience about vaccine. And so the vaccine issue is very, very sensitive. So Japan was possibly the slowest among all the OECD countries to start the vaccination process. And any vaccine has to be tested in Japan with Japanese national. Even if you have tested outside, the government by law cannot actually accept that type of vaccine. So it takes a long time. So what I'm trying to point out here is that somewhere we have a very strong high risk arising from the first 4 points. And then there are some challenges to tackle to address this particular issue, and which actually we are still ongoing because of this last 2 issue, as I mentioned, that it cannot have a forced lockdown and has a very, very sensitive vaccine policy. So keeping that in context, let's look at some of the numbers. I think this is the numbers which I saw yesterday or day before yesterday. Japan has a population of around 123 million. And now the total cases are 1 million and 15,000 deaths. Recovered is around 980,000. And we have, as you can see, 1, 2, 3, 4. And currently, actually, we are having the 5th peak. So as I say that, I'm seeing the TV also today that Tokyo has around 4,000 cases or so. And that's a very, very high alarming point. And just keep in mind that when I say 4,200 cases, Tokyo's population is around 22 million. So with a 22 million city, 4,200 cases, possibly it's all like how we deal with the numbers or how we interpret the number. So first case of Japan had January 16, as early as January 16, 2022. And first case in Japan without a travel history was January 28, 2020. So, so you can imagine that how early actually this whole spread was there. A little bit of vaccination thing is that although Japan took a very cautious move at the beginning, now the speed up vaccination. So like for example, I already completed. I can hear some noises. So may I request our participants to mute yourself if you are not talking. Thank you. Like say, for example, I completed my vaccine, and my son, who is around now 16-year-old, so he will have his first dose tomorrow, actually. So now it has speed up, and 99 million. So you can think about that. The total population is, as I mentioned, that 123 million. So first dose, at least fully vaccinated part is certain percentage, and the population fully vaccinated have been 33% or so. So it is actually taking up a little bit strongly. Now, a few issues actually, which was extremely important. And when I analyze all these issues, like first 1.5 years, some of the key learning was that number one is that the high level expert group, which was like developing, that we had this infodemic thing, like the fake news, noises, and all those type of things spreading. And it is still spreading. Still, there are lots of news that whether we should have a third booster, whether this vaccine works, whether that vaccine has more side effect, and all those type of different types of noises. And most of these noises or fake news have without any specific scientific background. So in Japan, as early as 14th of February 2020, I should have written 2020 here, last year, 14th of February, when the first COVID-19 death was reported, that time an expert group was formed under the cabinet decision. And when it formed under the cabinet decision means that is the highest level of expert group. And it actually came from the past experience of SARS, MERS in 2003, 4, 5, and so on. And the interesting part of this expert group was, it was very diverse. It has experts in the infectious disease, public health specialists, virology, lawyer, and they were supported by a working group who had this very diverse group of people, like the data scientist, logistic expert, AI specialist, and so on. So in one way, yes, we need the public health related expert, but as we all understand that the response to this pandemic is not just the public health issue. It needs a collective different types of discipline, be it data scientists who actually analyze big data, AI specialist who makes all the future projections, different types of logistic expert that, okay, if we have an emergency, as I mentioned that there is no lockdown, but emergency means there will be certain constraint on certain types of activities and people make self-restraint. So what will be the logistics issues and so on. So that type of collective expert input was very, very important. It has regular simulation exercise and future scenario and try to find out what are the very specific urban hotspot. And another very, very important thing, which is actually still continuing, is this regular press briefing jointly by the minister and head of the expert group, and periodically jointly by the Prime Minister and head of the expert group. By regular, it is usually once a week. Sometimes if during the very high peak time, it's almost every day or maybe alternative day. But the important part was it was the minister and the head of expert group. So we have the political leader and the scientists together. They're coming together in front of the camera. And that's a very, very important thing. And also periodically the Prime Minister himself comes, but again with the head of the expert group. And this was a learning from the Fukushima nuclear meltdown, where we had also similar type of disbelief, because that was also an invisible disaster where we don't know that what is the amount of radiation in which part. People say that, oh, government is trying to downsize the radiation level. The NGOs will say something else. Then the academics or the universities, they will make their own statement. So it was quite a bit of chaos that time. And that had a mistrust on the information. So that's why taking that particular lessons here from the very beginning, that they try to make it apolitical and making it more science-based information sharing. And that was possibly one of the best things which happened in Japan during this whole pandemic, that whatever the science is saying, and the political leader is actually taking that words from the scientist and explaining it. And I have seen that many of this type of press briefing, when the prime minister or the minister, they cannot explain, so they are asking the head of this expert group to explain it, the scientific thing. So that interaction actually was very, very important, and that possibly helped us. I don't say that there was no infodemic issue. There are still, of course, always there would be, but at least it was reduced and there was not that much of panic like that. And another very important thing was the border control. And this was taken at a very, very early stage, because as I mentioned, that when this expert group was formed, they had the simulation that there will be the peak will be coming. But the main important thing was that how the peak will come, but how we can actually make this peak a little bit delayed, so that we can strengthen our medical support system, so that we can have more COVID beds in the hospital. We can designate some of the hospitals as the COVID hospital. Then we can actually use some of the milder patients, possibly in some of the hotel rooms. So those type of arrangements and all those type of things. So I think the border control at the initial stage really helped a lot. And another very strong focus at the initial stage Japan took was this cluster-based approach, and where they tried to identify the mode of transmission, try to identify the clusters very specifically, and then try to trace that cluster and try to make an end, actually, to make the final wall, so that that cluster does not spread very highly. So that the border control and the cluster-based approach was very important. Now, these 3C, we call the closed spaces, crowded spaces, and close contacts. So this became one of the key mantra of, we all know now, but at the very beginning, there were quite a bit of programs and awarenesses and some this type of posters in multilinguals and so on. And some of the other interesting thing which I found was very also interesting was this, how you generate the public attention. Not everybody is looking at the numbers, not everybody, especially the young generation in Japan, they don't see that much of TV news and so on. So their main use is the smartphone. So what they do is like this, what you are seeing here, left-hand side is the Tokyo Metropolitan Government building. So, and this bridge is one of the major bridge which connects Yokohama and Tokyo. We call the Bay Bridge. So they make this type of different color coding. So when it is this type of red color, that means that the numbers have exceeded some threshold value. When it is this type of blue color, this is a little bit normal situation, but we need to be cautious like that. So for this type of many cities landmark, there were this type of lighting, and which actually catch people's attraction, and at least people come to know that, oh, today we need these numbers are a little bit high and low and all those type of things. To sensitize the people, I think, with the numbers are sometimes very, very important. We recently did this paper, not recently, means last year it was there. Yeah, as Chris mentioned that since usually I have lots of travel around, but this time, this year, last year and early this year has been quite productive in the sense, no travel. So sitting in home, having online lectures and so on. So quite a bit of plenty of free time. So we try to do several of our research focusing on this COVID. And this is what we try to understand. Like these two papers talks about one on this governance, technology, and citizen behavior. And this was an collective lessons from East Asia. So we compared China, Japan, Korea in a comparative analysis. And the right one is more specifically on Japan, that what helped in initial flattening of the curve. So as I mentioned that the curve is very important, that how you delay the initial peak like that. And what we found is that, yes, the government response were important. as I mentioned earlier, the high-level expert group, scenario planning, cluster tracing, border control, and so on. But also important was the cultural part of it. And, you know, Japan, usually, Anshu knows it, Chris knows it, those who have been to Japan, you might have noticed is that Japan, the mask culture is very, very common. Even in a regular season without this pandemic, the December, January, February, these 3 months are usually the regular influenza months. And during that time, you will see at least 30 to 40% of the population, they are using mask. They use mask for two reasons. One is if they have a little bit of mild symptom, just make sure that they are not getting affected, means they are not affecting others. That's one way. And also just to take protection because this is an influenza season, not to get affected. So the mask culture is very important. The hand washing, I still remember that when my son joined the elementary school, first grade, or even before the elementary school, during the daycare center, even the daycare center, they teach very rigorously that how to do the hand washing. And there is very specific actually session for hand washing. Even if you go to an elementary school, you will be seeing that in front of there are long basins where you have many taps and you will do the hand washing, and there will be posters that how many times you have to rub and how you do the hand washing. So again, this very basic sanitation habit, that has been actually quite inborn from even at the very basic early childhood. And that sometimes helps a lot. The food habit, there are arguments for and against of that. Some people argue that some of the specific Japanese dishes, it actually helped. But again, I won't go into the details of that, but also it's some food habit, some immunity system. But I think here the most important thing is that a very basic sense of sanitation from your very basic early childhood, that really, really helps you in making it as a regular part. Like whenever you come from outside, whether it is COVID or not COVID, the first habit is that you first go to the wash basin, hand your wash, and then you touch anything. So this has been a common practice. We practice it in home even before the COVID came in, and we found that that really, really helped a lot. So citizen behavior, as I mentioned earlier, that when the government has no legal instrument to impose a ban on the citizen, it has to depend on the spontaneous behavior of the citizen. And so how sensitive they are, how their practices actually help, I think that was one of the main strengths which Japan had. Then last year, as we have seen in India also, in Japan as well, that there are many different types of natural hazards, whether it is cyclone, flooding, strong heat wave, then one earthquake. So it happened actually within Japan. So this adaptive governance becomes extremely, extremely useful. Not that the traditional way of shelter management did not work. Traditional way of volunteer management did not work. Then many people did not want to go to the shelter. So there needs to be some special care for them in their own home. So that also really need to be changed. So these all different issues, and there was no manual available for that. And this actually what we call the adaptive governance. And from last year experience, I think this year we are better prepared. Like we had a major, like 3 cyclone or typhoon last week during the Olympic, almost at the end of the Olympic. So 3 typhoons came at the same time. And this was again first time we are seeing that this type of typhoons in 3 different locations of Japan. And then the Olympic is going on. The COVID had another peak. The 5th peak is going on. So it's becoming a very complex emergency in many different ways. So how we deal with this complex emergency, and there are no standard manuals which are available. So we need to adopt it. And this possibly becomes the new future normal, what you call the adaptive governance. So I think this is my final slide here, that to summarize some of our observation in Japan, that I think in spite, the positive part is in spite of no lockdown, no instrument, I think number of deaths were rather controlled. Like today also in Japan, total number of cases are around 10,000, but the whole country, the death is around 9. Yesterday also it was single digit. So at least the numbers are increasing, but the death, because our ultimate target is that people should not die. I mean, you can't stop the business in this type of situation, but how we reduce the death, I think that's a very important part. So that was, I think, the positive part. And basic healthcare system that really helped both in the urban and rural area. That's also very, very important, that we have basic healthcare in many times in the urban area, but there is a disparity between urban and rural. But I think in many times, Japan did not do that many PCR tests, and that has been a huge case of criticism. But usually what happens is that Japan does lots of CT scan, and the CT scan machines are very common in many of the places. Like even in my neighborhood, there are some small health clinic, not the hospital. So there is the CT scan. So whenever we go there for normal coughing or a little bit of sort of catching cold. So the first thing we do is this, the chest scan type of thing. So I think the basic healthcare system really helped in some way. The third point is the expert advice group, joint press briefing with the diverse stakeholders and expertise. And finally, the people's attitude, behavior, and basic hygiene habit. So that has been the positive part, but of course there are challenges. There are less PCR tests, and some major companies, they wanted to do the large scale testing, but that did not happen. There was some conflict with the medical team as well as those type of private company. Then, you know, there has been always this tug of war between the medical body, medical professional body, and the business lobby. Business lobby needs to save their businesses, and medical people, they need to see that the medical care system does not collapse. So it was in between, and the political system were in between actually this tug of war. There were quite a bit of unemployment, loss of employment, and so on. And when we talk about this emerging technologies, maybe Anshu is a much better position to explain it more. We have been seeing lots of new technologies now used, whether it is AI and so on. Like say, for example, my wife, she went to overseas trip first time in July after the 2 vaccinations. She came back last week, and now she is in home quarantine. Although the country where she went was in Armenia, there are no cases. So, but she decided to do the 14 days of home quarantine. And then now every day there will be a call, and this call is, earlier it was a manual call from the health center, but now it is AI driven call, and you need to actually show that, okay, you are in home. And of course the tracking little bit about your smartphone. Usually the tracking is not, it's considered against the privacy. So you have to actually give your consent. And that's a very delicate legal system Japan has, that Japan cannot do that. Okay, this is emergency time, so we will I'll try to track where you are and so on. Japan cannot do that. First, they will request you. You have to give your consent. So my point here is that, yes, we have technology. You can use the technology, but the use of technology and people's privacy and sort of freedom, I think it has a delicate balance. So how we keep that delicate balance, there are always the argument whether it is good or bad. I'm not sure about good or bad part. But as a result, what we have seen is that when we did the comparative analysis between China, Japan, and Korea, we have seen that in China is like, I won't say famous, rather infamous for its this privacy issue. That you don't have actually any privacy, and government can control, they can track you everywhere. And that's how probably they use lots of technology in a very, very strong way, in a top-down way, and bring down the number. So that's a different governance mechanism. But for Japan case, the technologies are available, but its application needs a little bit of more softer approach, a little bit of more legal provisions and so on. So there is always this particular gap. And I would like to also hear a little bit more from Anshu on this aspect, that what are the cases in India, especially like how this technology, people and the communication are becoming interconnected. So I will stop here for the time being. I pass it to Anshu. Anshu, for your intervention, please.
Thank you, Rajib. As always, there's so much to absorb. And although, as you said, while I am familiar with Japan, I've had a part of my education with your support there, but there is always so much inspiring things that we can learn. I think the way the public messages have been going on, as you showed, was really, really nice. I think what we have is, we have just a little over 20 minutes. I think the schedule is a very nicely made, very well thought out one, under which we have time between both of us till 3:15, after which there is a Q&A that has been planned with the participants with the help of Dr. Claribel and Professor Suresh. And then we definitely want to hear Professor Menon on how he sees as the take-home message for this. It's really, for me personally, it's really a great experience. After so long, we are having this kind of an interaction. You're here, Professor Krishnamurthy, Professor Menon. I don't see Michael Chiromani, sir, but I remember his district handbook was perhaps the first Indian document we all had ever seen and so inspired with. So what we can do, I was thinking in these 20 minutes is to talk about a few issues that emerge out of, what we have experienced. And I can share what I have experienced since seeds, where I come from, works on the ground. We were, before the pandemic happened, we were responding to disasters. We were doing disaster risk reduction programs, including school safety and safe construction practice work. And then when suddenly this happened, some of our previous work got stalled, but the new work was in the domain of supporting communities that were very hard hit by the pandemic. So that was the first few days when we first went into a lockdown, March of 2020. But then what happened was, at that time itself, some people within our group started a conversation that although there is a lockdown and there is a pandemic, it does not mean that nature will stop the disasters that happen otherwise. So cyclones will still happen, earthquakes will still happen, floods which happen every year will certainly happen. And how prepared are we to deal with that? So one of the first challenges, and I was proposing, Rajib, in the next 15-20 minutes, 3 challenges that I wanted to put on the table and also hear from you, your perspective and what you've seen in Japan and what you've seen in the rest of the world from Japan. But for us, one of the first and the biggest challenge was, what do you do when you get a disaster warning during a pandemic? A warning for another disaster, a naturally triggered disaster. The most obvious ones for us and the most difficult ones have been cyclones, because you do get a warning, and now with improved meteorology, you get a warning of 7 to 10 days. And the warning is fairly precise. You know the track, you know what's going to happen. But in that 1 week, how will you act? Because number one, there's a lockdown. Number two, the people who are supposed to respond are themselves affected. There was a very high share of people in government services who are frontline people who couldn't sit at home during the lockdown. They were down with COVID. We lost many very good officers and field people in these last 1.5 to 2 years. Our own teams were affected. Someone in the family is affected, or, for our field workers, wherever there is anyone who had senior citizens or very small children in the family, we said that these people should not move out. At that time, there was even no vaccination. So now your response capacity has gone down. The capacity of the community that is going to get hit by this disaster is also already down. They are in a lockdown, their incomes are reduced. Many of them are daily wagers who get hit very hard. They're really looking for help. And let's say cyclone. So we handled, Amphan was the first big one that we handled. Then there was cyclone Nisarg last year. Amphan hit West Bengal really hard and a little bit in Orissa. Then we had Nisarg, which was in the other coast in Maharashtra and Gujarat. Then we had Nivar, we had Burevi, Tamil Nadu and Kerala getting hit. And then this year again we had Yas and we had Taute. So we've seen half a dozen cyclones during the pandemic, and repeatedly there has been an issue. One of the big things that also came up is when you evacuate people, where do you take them? So there are, in most of these coastal areas, the communities and governments are used to cyclones. There is infrastructure, there are cyclone shelters, or there are public buildings like schools that have been identified as cyclone shelters. In fact, only a week ago, I was talking to somebody about the community college that Professor Krishnamurthy had once set up and run so beautifully, focusing on disaster risk reduction in a cyclone shelter building. So we have this infrastructure, but when we did calculations on how do you accommodate evacuated people in a cyclone shelter, it's a very acute problem. Now you have to maintain social distance. So we tried all combinations. So the standard thumb rule that India follows and the global humanitarian thumb rule is, in an emergency shelter, you need 3.5 square meters of space per person. That is the average you need if you account for how people will sleep, there is circulation, there is personal space and everything. So the first problem was that if we try to put social distancing, this becomes huge. But we try to make a system where you have bed, one of the pictures you also showed where you can do some kind of screens that separate people who are sleeping. So it may be still a big hall, but you are literally not coughing and sneezing and breathing on each other. So it's some amount of screening, which again requires time, cost and material and effort. But if you do that, you still need 5 meters square per person in an emergency shelter during a pandemic. That suddenly increases the requirement, the space requirement in these cyclone shelters to almost 1.5 times of what we already had. So how do you accommodate people? And thirdly, during that evacuation period, there are cases, there are people at home who are down with COVID or in quarantine. How do you handle them safely? If there are cases within that evacuated group that is in the cyclone shelter, how do you handle them safely? So this was the immediate problem. And then let me also leave two last thoughts. One was, how do teams go and conduct relief work? And very lastly, how do you, when you do this relief work, as a civil society organization, we do this a lot. How do you remain accountable? Because we are accountable to governments and to our donors. We have to take a record of who got what assistance. We have to make a report of it. The local authorities have to verify that. For that report making, we are always taking people's signatures, or we are taking their thumbprints. There is a sheet of paper or a register. Thousands of people come and put their hands on it. And suddenly you can't do that because that's a fomite. You can't, that will become a way of spreading the virus. These were some of the very strong initial challenges we faced. We tried to do a few things. As I said, we tried to rework the space requirements. We tried to talk to local governments, local community leaders on how we can find more space to accommodate these people according to these requirements. I spoke about the transparency piece. So it was a very new experience for us with technology. And today we are talking a bit of technology. The good part of the pandemic, silver lining, is that technology has really made huge advances. while in theory it was possible to talk like this even 2 years ago, but this Zoom kind of features were not so good. The broadband was not so good. We did not know how to share screens and mute each other and ourselves and hide the camera and change backgrounds. All of this has happened. So this also benefited the work on the ground. So we could take video recordings of the relief work. We could get the same sarpanch or a local municipal leader who had to first sign a document could now say it on a little video clip, and we could attach it and we could send it instantly. So the record keeping completely transformed. And I think so far we have not been able to compile all of this and even reflect in detail. But I think with help from you, Professor Rajib, Professor Krishnamurthy, we should perhaps even think of doing a little bit of research or at least a paper on how these advances happened and what gaps still remain. So I'll pause here. The other two questions, Rajib, I'm going to talk about is how do you do recovery in a pandemic and how do you continue your DRR work in a pandemic? But that's just for the next few minutes. I'll pause here. If you have any thoughts on how you've seen this happen, how Japan and other countries have handled disaster warnings, evacuations, and relief during the pandemic. Rajib, I'm handing it over to you, but you are muted. Oh, you can't unmute. Is that so? Oh, can the moderators please allow Professor Rajib to unmute himself?
Yeah. Okay, now I can.
Hello.
Thank you very much. Thank you, Anshu, for I think it's very important point. Actually, we also faced the same thing last year. There was a major typhoon. Means in Japan we call it typhoon, the cyclone, and flooding in southern part of Japan, the area called Kumamoto, where again there are two people whom Chris knows very well. Takeuchi-san and Miwa Abe-san. So we have been doing some field work, and we were discussing with the local people, the local government, and so on. One very interesting thing came out. We tried to compile actually this in some sort of report. I can share that report also. It's also available online as well as in the Provençal web. That in Japan, like we have, similar to India, we have also a designated cyclone shelter. But then the designated cyclone shelters are entitled to get different types of relief activities and relief materials. There will be a designated person from the local government to manage that area and so on. But this time what we found is that there was lots of non-traditional or non-designated cyclone shelter. Many people actually, they went to take shelter into the hotels. Then there were like the large supermarkets parking lot where people just actually drive, and then they didn't just want to have any interaction with other people. So just spend the night there within their own car. Yes, it will have a little bit of negative impact on your health, but at least this COVID thing was a little bit controlled in that way. And also there were lots of collaboration with especially the hotels and restaurants who actually, since the hotels did not have that type of business due to this COVID situation, so the local government actually tied up with some of the hotels, and they designated some of the hotels as temporary cyclone shelter type of thing. So people can actually go there, and the arrangement they made is that it was not fully free. Certain percentage, the people who go there, they will have to pay. It's a very small amount, but most of I think it was 80-20 or something like that. 20% you have to pay, but 80% will be covered by the local government like that. So that type of arrangement was actually mutually beneficial. It was a good business for the local the hotels as well, but it was also very good, especially for the old people who did not want to actually go to cyclone shelter because of this fear of getting the spread. So they were mostly accommodated in this type of what we call the non-traditional or non-conventional cyclone shelter. So like my main learning here was yes, like we have this concept in Japan, we call, you know it also, that self-help, mutual help, and public help. Self-help, I help myself. Mutual help, I help my neighbor, and public help is the government help. But I think here another type of help worked very well, or which was very much required, was the network help. Like we have the self-help, mutual help, public help, but to make it working, I think that different types of other non-traditional stakeholders, be it a business sector, be it an hotel owner, be it and maybe the supermarket, and all those type of non-traditional stakeholders, they actually came very strongly. So that was very useful. Another very interesting thing, another example, like, you know, that when we have after the cyclone, we often call the 1995, the Kobe earthquake year, is the year zero of voluntarism. I mean, there were voluntarism earlier, but that particular year, it actually started a new voluntarism mechanism in all over Japan. So now there are national volunteer system, and those are actually disaggregated into prefecture level. So there are many pre-registered volunteers and who actually goes to serve the affected area. But here what happened is the most of the prefecture, they prohibited to get the volunteers from outside the prefecture because of, again, the pandemic spread. So they only started accepting the volunteers within that particular prefecture. And again, I give this example of Kumamoto prefecture, which was hit by the cyclone and flooding, that, you know, due to COVID situation, there were lots of students who lost their part-time job. And they were actually wanting to do something. So what they had done, the Kumamoto prefecture with Kumamoto University, and there were the other universities. So there was around 8 or 9 universities. So they had, again, a consortium which has been formed. So they told that if the students who wants to do volunteering, it will be mainly volunteer, but it's a small token of appreciation and they provide. So it can be actually, they can think that, okay, it's a sort of part-time job also. So since there was a huge gap of these volunteers, so to encourage that, so there was a new system which was developed by the prefecture government and with the university, so that this young student, they can do volunteers within their own prefecture. So again, like these are all the new things which we never experienced, which we never thought of, but these are all our learning and possibly under the overall umbrella of this adaptive governance. And as you rightly pointed out, that the innovation, I think, and I always say that the COVID-19 could put lockdown on everything, but it could not put any lockdown on innovation. Like 10 years of innovation was possibly done in 10 months. As you rightly pointed out, the 2 years before we were not thinking, and your ways of like the documentation earlier, like the analog document to now we are turning it to more on the digital documentation, and we were not thinking that earlier, but this situation urged us to do that. So I think that's possibly a positive part of it, and we will possibly see more innovation in that way in future as well.
Oh, great. No, God willing, we will. And this adaptive governance is something I think in the coming years, we will all need to work a lot more on. It's the word itself shows you how some of these doors can really open up. In the interest of time, I will merge the other two things that I had intended to talk about, which was on how do we take up the issues of recovery and reconstruction, and how do we continue our work on DRR that we had been doing. So, and since you've already touched upon innovation, I wanted to talk about a little bit about technological innovation and how we can all be part of that journey and make more work on that. So, again, in the work that we do, one of the things that was very noticeable right in the beginning was the impact, the livelihood, or the secondary impact on the poor. I'm sure all of you felt the pain when we were seeing images of the migrant workers who were walking home. And a few months later, we started getting, we started hearing from them, even in the villages where we were working, that they could not stay there for very long. They needed to come back. And some of them started trickling back, but there was still no work. So the fear of the disease was still there. And then there was still no work. And the worst hit was the informal sector. When we talk of MSMEs, the medium, small and micro enterprises, it is the micro and the smallest micro enterprises those that employ 2 to 5 people, have a turnover of less than 10 lakh rupees. They are the ones which really did not have the capacity to stay on. They couldn't even pay their rents of the shops or the small units that were closed. So some work we tried to do there, and some work we tried to do to continue our efforts on disaster risk reduction. We tried looking at how even in a remote environment with the technologies, we can look at where vulnerability is there and strong. So in an early conversation, and although that's not much work that has happened there, but one thought that came around was that even the spread of COVID can be anticipated in some of our communities fairly well. If you start looking at the densities in these urban areas, especially the urban poor areas, and you start looking at the re-emergence of traffic, Google traffic maps we all see now, they tell you where there is a complete lockdown, where the lockdown is not being followed, and where after reopening the full force of people has come out. So you could see that in real time. And suddenly it became very evident that it is possible to interpret hotspots where there is trouble that is brewing currently. I'll take a minute to talk a little bit about an AI piece of work that we have been trying in these last 2 years with support from Microsoft. There's a data science team at Microsoft with whom we've been working. And when we talked about this kind of application, we also then thought that if you are able to see, now the kind of high resolution satellite imagery, and I'm not talking about buying any high resolution, all of us on our phone, if you open Google Maps or Bing Maps or Apple Maps, whatever you use on your phone, if you zoom in for a city like Chennai, you will find that the resolution is somewhere from 30 to 50 centimeters in most places. That is high resolution. In a high resolution image, you can actually read a lot about the houses that you are seeing. You can make out the shape and size of the roof. You can even make out the material of the roof. So if a 5-10 square meter roof with a thatch material is there, and there is a 50 square meter roof with a concrete material, and there's a 30 square meter roof with a tin sheet material, you can actually, you see only the roof, but you can infer a lot about the walls, the foundation, probably even the family that is living inside, right? So these become proxy indicators for some of the things that we want to understand. And the beauty is that sitting in your room, even in Yokohama, you can see every single building in India. So I don't know if I have the privileges, but in a few seconds, I wanted to see, will it be possible for me to share my screen? Please let me know if you can see my screen. Okay, so this is an image, and this is not from a big city. This is for a slum from the edge of Puri. So the image is not very clean, and I'm deliberately using, because not every image is going to be a very clean, high resolution image. But even in this image, we can make out different kinds of houses. And the image we use for this first trial is actually from 2019, just after Cyclone Fani. Some of you would remember that. And you can even see some of the buildings that have lost their roofs. The roofs have been blown off. You can identify plastic sheet roofs, you can identify concrete roofs, tin roofs that are sloping in 2 directions, tin roofs that are 4-way sloping, 1-way sloping. And what this does is it tells us it is possible to give a risk score to these buildings. And then what we can do is, if I jump, these are the only 2 slides I wanted to show. This is from this year, just a few weeks ago, Cyclone Taute hitting Porbandar. A couple of days before that, we ran this model in Porbandar, and here in these dense settlements, it is telling us clusters of buildings which are of highest risk. So now suddenly it is possible for you to reach out to the municipal councillors, to the municipal commissioners, to the local volunteers, NGOs, that this is the lane which is going to be worst hit in this locality. These are the 5% people who are at highest risk. You have 48 hours to get them out, or let them know that this is going to happen, how they can find the safest route, how they can get to the safest buildings nearby them. So with that, we are kind of running out of our time, but Rajib Sensei, for the last time, back to you. Any thoughts on how these processes can transform or improve disaster management, learning, teaching, research, practice And also probably not just disasters, but the very core planning, developmental planning, planning. Rajib Sensei. And also requesting all participants to kindly mute yourself. Thank you.
Yeah, thank you. Thank you, Anshu, for this great example of using AI, using the Google map and try to understand the vulnerability thing. I think that's why, I mean, these are possibly the approaches which we need. And it's not just one technology which is important, like how we connect different types of technologies. I think that's possibly will be the new ways of addressing our DRR work, addressing the different types of policy related work, or also the recovery work. I just give you an example of this. You mentioned about the MSME, and last year with the UNDRR, we developed this very small tool, which is the self-assessment tool of MSME, especially that how is their risk, especially on the COVID-19 risk. And one of the challenge in the MSME in India is that most of them are non-registered. And when you don't have the registration, so the local government level, there are hardly any data which you can actually think about and which you can actually utilize. So the important part of this process is like how we incentive, how we provide some sort of incentive for the MSME to register into the process, and also engaging them for making the like more a robust assessment of their own risk. I won't go into the details of that, but I would like to just show one slide here that this is a self-assessment tool which we developed, and there was a paper also we published based on this process. That you mentioned rightly that the building types and all those type of things. So here we use mainly the 4 different parameters: health, behavior, exposure, and social policy. And that it's actually more like a citizen science type of approach, that where you make your own judgment and then you upload it, and then it actually turns into this different level of risk, and it turned into a map. So if now after I listened to you, so I was thinking that if we can actually combine this type of tool with the work which you are doing, I think we have on the map little bit of self-assessment and using more as a citizen science. And then you have also the AI-based vulnerable analysis. So combining these two, I think it will have a much clear picture for the local government that which part of the area is of high risk, both in terms of COVID-19 as well as the future, like the cyclone and all this thing. And that possibly will help them to identify that which area needs possibly a different approach of, or what we call maybe the non-conventional or maybe the adaptive approach of the making them to a different shelter or putting them to some other places and so on. So my main message here is that like there are quite a bit of new technologies ongoing, and the next challenge for us would be that how we utilize or connect these technologies together for a collective risk assessment as well as the recovery planning.
You're absolutely right. In fact, you remind me of some amazing work. Many years ago, we had seen on bathymetric studies that Professor Krishnamurthy and his team were doing in University of Madras. And even I was at one point thinking that, you know, if you're talking about cyclone-induced floods, it is so similar because the bathymetric studies will tell you how the storm surge is going to move. So now I think I fully agree with you. Is the time for combining a lot of these isolated efforts that have been going on, that we all have also been part of. I think we are all equally eager for the lockdowns to get over so that we can physically go down to Chennai, meet all of these colleagues, and maybe do something interesting together. So with that, I think we will stop here. We'll take a pause, Professor Krishnamurthy. We are a little over our time.